Thoracic outlet syndrome. Thoracic outlet syndrome is a syndrome involving compression at the superior thoracic outlet, resulting from excessive pressure placed on a neurovascular bundle passing between the anterior scalene and the middle scalene muscles.
The nerves from the lower part of your neck branch out off of the spinal cord and then run down into your chest, shoulder, arm, and then shoulder blade as well. So symptoms can be anything from burning, shooting pain. Most commonly in the clinic we see a numbness with the pinky and ring finger right here. And commonly when we talk with those people, they'll sleep like this, or they had some sort of injury where they landed in this position, or they might sleep on their side with their arm extended, or sleep with their arm folded forward. And what happens, their shoulders shrug forward, and what happens is that nerve bundle, it's called the brachial plexus. You can Google it, but that brachial plexus gets closed down. It can cause nerve symptoms, and then there's a major artery right there as well, which can be closed down or pinched upon, and that'll create some changes in temperature and changes in blood flow within the
It can affect one or more of the nerves that innervate the upper limb and or blood vessels as they pass between the chest and upper extremity, specifically in the brachial plexus, the subclavian vein, and rarely the subclavian artery, which does not normally pass through the scalene hiatus.
Welcome back. Today we'll be addressing thoracic outlet syndrome. I know a lot of you were interested in having a video shown which would reveal the sleeping positions, the stretches and exercises, and in order to correct this condition, a condition where the brachial plexus, a tube that contains the median, ulnar, radial nerves, supply function to the hand, where it passes between the upper pectoral and the collarbone. It often becomes impinged, giving full hand symptoms. And so with these particular sleeping positions, corrective stretches and exercises, this condition can be alleviated, and you can be symptom free. So you do not want to sleep. One of the main ways you do not want to sleep.
Thoracic outlet syndrome may result from a positional cause, for example, by an arm compression from the clavicular and shoulder girdle or an arm movement. There are also several static forms caused by abnormalities and enlargements. Or span of the various muscles surrounding the arteries, veins, and or brachial plexus, a fixation of a first rib or a cervical rib.
I'm Dr. Jeremy Holzbach, and you're watching the Gateway Minute. Thoracic outlet syndrome, or TOS, is a common occurrence in its most subtle form. TOS is often seen in individuals performing significant overhead work or with frequent postures requiring the arms to be held in shoulder flexion while working. This injury can occur when there is compression of the neurovascular bundle between the first rib and clavicle, between the anterior and middle scalene muscles of the neck, or behind the pectoralis minor muscle, causing intermittent positional nerve entrapment. Clinically, females experience this condition more than men and occurs between the ages of 20 to 80 years of age. They also have a history of pain, numbness, and tingling in the arm. Treatment here at Gateway Chiropractic can include traction therapy to help stretch the cervical spine while releasing pressure off the nerves, Graston technique to reduce muscle tension and adhesions, the chiropractic adjustment to restore normal biomechanics within the spine, and even therapeutic exercise to help strengthen and re-educate the surrounding structures. For more information, give us a call or visit us on the web at gatewaychiropractic.com. So take control of your health today and get the edge on your injury. As always, thanks for watching and have a blessed week.
A Pancreas tumor can lead to thoracic outlet syndrome in the progressive stage of the disease.
Hello, I'm Dr. Greg Mineta, and this is a Society for Vascular. There are two variants of the arterial form of thoracic outlet syndrome. The first can be termed the arterial major form of thoracic outlet syndrome and is generally associated with a previous clavicular fracture or a cervical rib. A cervical rib is an additional rib present in the lower.
The most common causes of thoracic outlet syndrome include physical trauma from a car accident, repetitive strain injury from a job, such as frequent non-ergonomic use of a keyboard, sports-related activities, and anatomical defects such as having an extra rib.
For venous thoracic outlet syndrome. Paget-Schroeder syndrome, also referred to as effort thrombosis, refers to primary thrombosis of the subclavian vein at the costoclavicular junction. It's the most severe presentation of venous thoracic outlet syndrome and results in severe disability if unrecognized or improperly treated. The clinical presentation is classic, with the patient complaining of a blue, swollen, heavy, painful arm. 60 to 80% of patients report a history of vigorous exercise or activity.
In pregnancy, if a narrow superior thoracic outlet exists previously, the patient can have seen symptoms for the first time. Joints loosen during pregnancy, making it easier to develop bad posture. Common orthopedic tests used are the absence test, the costoclavicular maneuver, and the hands-up test or EOS test. Careful examination and X-ray are required to differentially diagnose between the positional and aesthetic etiologies. Physical fixations, escalating muscle spasms, and a cervical rib or fibrous band. Thank you.